Hello, I'm Dr. Lewis Teperman, Director of Transplantation at Northwell. Today we're going to speak about a remarkable story, a lady that had fulminant liver failure. Fulminant liver failure is when you're perfectly healthy, you acquire a virus, and within 2 months you fall into coma. And in this case, she needed a liver transplant. And it's an accident of time if an organ is going to become available. She successfully had her transplant at North Shore University Hospital. And at that time when we operated on her, her liver was this size, when a normal liver is this size. She didn't have cirrhosis, she had hepatitis B. And hepatitis B in the United States causes less than 5% of all acute fulminant liver failures. And it's imperative that people come to the hospital when they're feeling sick. And she, as many others, didn't come to the hospital right away, but it wouldn't have made a difference. Because when we took out her liver and reviewed it, there wasn't a single liver cell living. We eventually found out what caused her liver failure, the hepatitis B, and what we think caused hepatitis B. And I'll let you hear from her specifically what we found. Thank you.
Hi, my name is Dana Smith. I'm 37 years old. I'm from Hollis, Queens, New York. And I'm going to just give you a brief history of what happened to me. Around Thanksgiving time, I went with a friend to get a nose piercing, which I still have. Stomach pains. I had loss of appetite, and then I began to throw up. I couldn't keep down anything, not even water. And after about 2 or 3 days, I began to throw up blood. So I asked my sister to take me to the emergency room, which at first I was skeptical of because of COVID. I didn't want to go to the ER because I was thinking, you know, I might catch COVID going to the ER. You're thinking there's nothing but COVID patients there, but thankfully I did ask someone to take me, and, you know, I went to the ER, which, you know, I did lose some memory of what happened, but I went in on January 13th, and when I woke up, I was told that I had to have an emergency. I was told that I contracted hepatitis B, possibly from the nose piercing, or maybe from not carefully, you know, properly caring for it after. And, you know, I just want people to know that if you are not feeling well, or if you think something is wrong, don't be scared to get and seek medical attention because of COVID, because it could be the difference between life or death. If I would have waited another day, you know, I wouldn't be here right now to tell you this, or, you know, the transplant that I received from the donor, it may not have come through for me. And I'm just very grateful for Dr. Teperman, his whole team. They took very good care of me, and it would scare you from seeking medical attention because there are other illnesses going on. People tend to forget, because COVID is such a big thing right now. People tend to forget, you know, you could get sick from other things, or you don't want to seek medical attention. And it's very important that you take care of yourself and you seek the attention that you need. Thank you.
In a little more than a year, we've done 3 cases for fulminant liver failure. Successful transplants at Northwell. As a rule, you'd only do 1, maybe 2. And I think this has to do with people not coming to the hospital readily enough, early enough to get treated, because hospitals, critical care units can help them. So never be afraid to come to the hospital. And also, if afforded the vaccine, if an opportunity, such as a transplant recipient has been offered the vaccine, you and everyone else should take it. I'm happy to answer any questions that anybody has.
Well, we have one question for Dana, if you want to join Dr. Teperman.
Well, now that you've gone through all this, what do you think about your daughter getting a nose ring?
I would highly suggest her not to. I mean, when she becomes an adult, she can make her own decision, but I would just say you have to be very, very careful, like where you're getting it done at, caring for stuff after. And if I could talk her into not doing it at all, that would be my, my best bet would just be like, just don't do it. It's not worth it because you just don't know what could happen after.
And Dr. Teperman, what is the prognosis for a person who's received a liver transplant?
Dana is going to be able to lead a perfectly healthy life. She's 37 years old, and
Could you just explain, please, Dr. Teperman, what exactly happened to Dana as a result of the Hep B? Why she would then require? You can use as a model why
Sure.
she required.
So the liver got infected, and there's something analogous to COVID here. So it's the body's reaction to the virus that makes you sick from COVID. In this case, it's the body's reaction to hepatitis B. And after a while, if the liver is normally this size, it shrunk down to here because the body killed off the liver. It also killed off the virus, but in doing so to protect her airway. So I really didn't have a conversation with her until after transplantation. And we got to watch the president be sworn in and the vice president be sworn in.
How long was the surgery?
The surgery took about 6.5 hours. Relatively easy surgery. The hardest thing there was getting the liver, and it's an accident of time. Individuals that had fulminant liver failure, their brain swells, and she was seizing after the transplant, and only for the critical care doctors and the hepatologists that were taking care of her, she's perfect now.
Now, it was a liver resection. Can you explain what that actually means?
It was a liver transplant.
Liver transplant.
Yeah, so we take out the old liver and we put in the new liver, and it's a lot of sewing, but she...
The last question is, how were you able to determine that, Dr. Teperman, that it was probably from the nose ring? You both can, Dr. Teperman first, but what did you both do to figure out?
She has no risk factors for hepatitis B. She hasn't traveled. She works readily. She's been working for Northwell for the last 10 years. And this was the one unique change that had taken place in her life, this nose ring, and it's the perfect time period for the virus to incubate.
And Dana, how did you help figure out that it must have been the nose ring because of the dates involved?
Well, when I was awakened, they started asking me questions. It wasn't something that I've had for years. I just got it for this to happen. So it was about 2 months.
We couldn't figure it out until all the tape was taken away from her nose, and I said, "Look at that. When did you get that? It's so tiny." Yeah. And she then told us it was right at the end of Thanksgiving.
Now, in terms of numbers, how rare would you say fulminant hepatitis B is? One out of...
In the United States, it's probably less than 5% of all the fulminant cases. The majority of liver failure that's acute liver failure comes from Tylenol overdose. But in Europe, hepatitis B is more common as a cause.
Okay.
She now undergoes her treatment at the Sandra Atlas Bass Center and the Organ Transplant Center at Northwell, graduating college and high school first.
So the question now is, how do you prevent going from a nose piercing to a liver transplant? If a person gets a nose piercing, should they make sure they have a Hep B vaccine before that?
Oh, I recommend vaccine for everyone. Hepatitis B, everyone should be vaccinated against hepatitis B.
Any other way to prevent?
Well, you should check out whatever place you're going to and make sure they're certified. The health department has looked at them and they haven't had an incidence of a communicable disease such as hepatitis B.
So far, I think that's it.
Great. Thank you very much.
Thank you.